going to make a long introduction. Madhu, please take the floor for me, and if you could officially open the meeting, that would be great.
Thank you, Petra. So nice to see all of you. We had an opportunity to meet many of you in person after a long time in Paris at the PPM working group, which was extremely well attended. I'm happy that Monica is here as well. We had to fight to get more space to accommodate the number of people who wanted to attend the PPM working group meeting in Paris. One day simply wasn't enough. And the fact that we have almost 2,600 people in this community of practice learning network just tells you that more and more people are clearly aware of the importance of engaging all providers. More and more people are acknowledging that patient pathways are very convoluted in the real world, that care is not easily accessible, care is often, diagnosis is delayed. And therefore, if we don't worry about all of this and only focus on taking care of sick people when they end up in the DOT centers, we're going to really not cut TB transmission. There is also tremendous interest in new tools. The Paris meeting, Monica had moderated a wonderful session at the Global TB Symposium, where everyone felt that this was the year when we have amazing tools, WHO recommended diagnostics, shorter regimens. There is so much we could be doing right away in improving the quality of TB services. And then, of course, the Paris meeting was like a huge showcase for the wonderful work from India on the rations trial, on how social protection genuinely matters. And there's no reason why PPM projects cannot also offer food baskets or support cash transfers or any other social protection mechanism and pass it on to their patients, so that we see a genuine reduction in TB incidence in the coming years. So we are very grateful to all of you, especially the next generation of PPM champions and advocates that we saw. We had a PPM booth in Paris, which was very popular and well attended. So Monica will say more about our plans to expand our code group for the learning network, for the PPM working group at large, and also think about potential new leadership that we really need to see in the next generation of people who will move the agenda forward. Thanks, everyone, and look forward to your feedback. Over to you, Petra.
Thank you so much, Madhu. It's always good to hear you highlight some of the key points that are in the larger context, and really appreciate you opening this meeting. I would like to give the floor now to Prachi to start the meeting off with a little bit of a promotional side for PPM and some work that we did in that regard within India. And Prachi, we collaborated closely with you to document some of the work that's being done on the ground in India, and we would love for you to introduce. We're going to show just a 1-minute trailer of a video afterwards, but Prachi, if you can maybe just give a few words of introduction.
Sure. Hi everyone, I'm Prachi Shukla from World Health Partners, India. And it will not be fair for me to start without applauding the work that's been initiated by TBPPM Learning Network. It has filled a gap in bringing forward the much needed attention and visibility of some very good groundwork that's happening around us, very near to the communities who need it. The best practices, the modalities in PPM that was never done before. Of course, individual organizations. Platform that's being done now with the TBPPM Learning Network. Through this, people across the globe could see and learn for their own programs. This virtual field visit will definitely help implementers to do some very credible work and improvise according to their local context. The documentary that Petra said that you will shortly see, a 1-minute trailer, was very much appreciated during the Lung Health Conference in Paris that concluded last month. A lot of implementers showed very keen interest in documenting their work. And I think as going forward for next year, maybe it will be good to take the South-South learning in capacity of advisory board member. But here you will in the trailer see 3 organizations who are doing groundwork, who are implementing TBPPM in different geographies of India. And I'm sure you will appreciate. Thank you so much, and over to you, Petra.
Thank you, Prachi. And without further ado, I'm asking Joel to just share a 1-minute clip of the video. Hope you can all see it. Joel, yes, here we go. Can we up the volume?
In 2020, India accounted for 26% of the TB global incident cases.
The only way we can end TB in India is to successfully engage the private health sector.
Most of the TB burden countries have large private healthcare sector. India is not an exception. Around 60 to 70% of the patients seek care in the private sector, which is diverse in size and settings. Hence, it is essential that we engage the private sector in the fight against TB.
தம்பிக்கு வந்துருந்துச்சு அதுக்கப்புறம் அவனே ட்ரீட்மெண்ட் பார்க்காமையே அவங்க லைஃப் அவனே பாழாயிட்டான்.
This is the power of partnership, innovation and commitment in the battle against TB. Together we can surely make India TB free.
Thank you. Now, I think many of you have already seen the larger video, and there are 3 different videos attached together. And I think we're going to share all the different links in the chat right now, so you can have access to the shorter videos to each of these organizations or the one larger combined video. And please share these promotional clips for anyone who wants to have a first glance of what PPM is. This is not necessarily a deep dive into each of these beautiful examples of work that's being done, but contact information can, of course, be provided for further questions. So now I would like to invite Monica Diaz from the World Health Organization, who is the key person in supporting the PPM, Global PPM Working Group, and is the lead on the multi-sectoral accountability framework and many other important initiatives, the NTB initiative in WHO. And I would like to give you the floor, Monica, to please set the scene for us on the bigger picture from WHO and the PPM working group and the UNHLM, and tie some of these areas for us together, how the learning network fits in there, and give us the bigger, broader context. Over to you, Monica.
Thanks so much, Petra, and warm greetings to you all. So we've come again now to the end of another year and another town hall. It's great to see you all who are actually champions of PPM. You've stuck it out to the end. We saw many of you in Paris, as Madhu mentioned. And that was a great opportunity. It was good to see many of you at the PPM working group meeting, where we had over 130 participants. As Madhu was saying, we had to bring in, sets of chairs in, like 10 chairs by 10 chairs. It was the demand was so high on a Sunday, that too. So it's great to see the community, the interest, the enthusiasm growing on public-private mix. And on the global picture, this is seen as one of those, those solutions that can help on all aspects. Now, let me start, when we say big picture, let me start with the global report that came out just recently. Now we're seeing for the first time recovery. We know that a lot of the recovery, of course, are contributions. We heard from several countries, for example, like Nigeria, where they said that, Nigeria, Indonesia, Cambodia, Vietnam, where Vietnam, for instance, and I see Dr. Hui here. So, that's a good example where during the COVID-19 pandemic, when everything was in chaos, it was the private sector which stepped up to help. And this is being seen increasingly the private sector is being seen increasingly as an important partner at the table, compared to 2 decades ago when all this work on PPM started at WHO, where we were being told to step back. We first handle things in the public sector, then we see everyone else. So this has been a major shift. So when we look at reaching the 3 million people who still miss out on care, which is the current situation, we know very clearly that PPM is going to be a solution. Likewise, in New York this September, world leaders came together, made massive commitments. So there's a commitment to ensure 90% coverage of all people who fall ill with TB. Now, this means reaching 45 million people over the next 5 years with treatment. It means reaching 45 million additional people with TB preventive treatment for those who are, who have for TB infection, basically. When you look at for research, now this is not pure PPM, of course, but again, the role of the private sector, of researchers, of others, is going to be key. So there are many offshoots of this, and we know that over the next 5 years, what we are aiming for is this accelerated push if we are to end TB by 2030. And this is why the commitments made by world leaders in the UN high-level meeting are so critical. So in this 5-year accelerated push, PPM is going to be a vital driver, or one of the biggest drivers through which we will see the biggest impact. So this is going to be critical, and this is exactly what we discussed as well at our global meeting of the public, the Stop TB PPM working group that WHO hosts the secretariat for, and that Madhu is the chair for, and we have William and Lal who are vice chairs. So, we all as a community have a big role to play looking ahead. And at the PPM meeting, we deliberated on what are going to be the key steps, what role can PPM play in this 5-year accelerated push. Many experiences were shared, many innovations were shared. One of the critical, I would say, one of the critical elements that was showcased very strongly was the work that we've been doing with the Bill and Melinda Gates Foundation through their support on, excuse me, strengthening accountability through data dashboards. We've been working over the past year with 7 priority countries to make sure that data is collated in a systematic way across the whole patient pathway, so that no matter where a person accesses care, we know what the whole journey is and that we have measuring points throughout. And this contributes very much to ensuring quality care, for planning, for prioritization. This is something, the development of these dashboards, that we hope to see come to full fruition towards the middle of next year, is something that we hope that all countries which have a private sector or an unengaged public sector leverage and strengthen their monitoring and reporting for better accountability. So these data dashboards, of course, are critical. We will share with you links, if you haven't already seen these, to our WHO website, where you can see or get a flavor of what these dashboards look like, with more data than ever before. Data looking not just at notifications, which is what we've been collecting for ages, but looking at notifications, access to WHO recommended rapid tests, access to treatment, access to TB preventive treatment. So all of these key elements are well featured. So this is something that we will be prioritizing, and we hope to have the engagement of all of you and the Learning Network in very strongly. The other element that we presented at the PPM working group meeting is you all are very familiar with our TBPPM roadmap that we launched in 2018. It was launched alongside just after the first UN high-level meeting political declaration, very well aligned, looking at what the roadmap is going to be, what are the key steps, what are the key actions towards reaching targets. Now we're looking at updating this roadmap so that it's more in alignment with the current commitments made by world leaders, with an accelerated push on what can be achieved. So the PPM roadmap is another element, and we will be sharing a questionnaire, a survey for more inputs, and we would appreciate your engagement, given that you are leaders, you are champions, you're working hands-on implementing PPM on the ground or advocating for it on the ground. The other element that I want to flag that Madhu touched upon already is that as the PPM working group meeting, we are looking to refresh our ranks, and it's great to see the new generation of PPM leaders here in this virtual room today. We will be putting out a call for membership for new members to the PPM working group, and we will be looking at also building the leadership of the PPM working group, of what leaders like Madhu and the leadership that has been demonstrated by Madhu, William, Lal, and all these stalwarts of PPM. But we want to elevate it with new experiences, with fresh ideas. So we're really looking forward to this. So keep your eyes peeled for this. And then the last element that I want to flag is that next year we will be having our PPM working group meeting again, as we do every year, but we're aiming to have it somewhere towards the middle of next year. So this is something also for you all, if you're interested and would like to continue to participate and stay engaged, is to stay, basically keep a year out. We will be sharing with you the invitation, and we welcome very much your close engagement and participation. So basically, in summary, there's a lot to be done, especially now that we're doing this big 5-year accelerated push towards ending TB. The next 5 years are going to be crucial, and PPM has a big role to play, and you have a big role to play as the learning network. And we urge that we all join hands in this effort to accelerate as much as possible towards ending TB. So thank you, everyone.
Thank you, Monica. I can feel the drive and the energy coming for everyone to push ahead and really. I think our network, thank you so much for setting the scene and for giving us the bigger picture. And clearly, everyone, keep your eyes peeled for the call for the PPM working group, as Monica ended on. So now I would like to give an opportunity to many of the community members who are with us. We asked around in various groups whether people would like to share some of their experiences from 2023. And we have some excellent variety of voices that have come forward. So without taking too much time on introducing everyone individually, because I know each of them has so much to say, and I would like to keep it crisp. I'm just reminding you that we're trying to keep the agenda short. So if you can keep to 5 minutes, please, I will introduce each community member. So Amna Rashid has been working for Mercy Corps. For those of you who don't know, she's been leading the Global Fund PPM grant in Pakistan for many years. And even though she has recently moved for personal reasons, she is still very much engaged in the work that Mercy Corps is doing in Pakistan. And Amna, I'm really excited to hear you give us a very brief introduction of some of the key highlights from the work that you do in engaging private providers in Pakistan. Please go ahead, Amna. Can you share from your side?
Thank you very much, Petra. Okay, let me try if I can share it. Otherwise, I will request you if you can share from there. I think it will be helpful if you can kindly share the slides, if possible at all.
just picking the slides up. So give me 1 second before I can share them. Here we go. All right. Can you see them? And you prompt me, Amna.
Yes, yes, I can see them. Yeah.
Okay.
All right. Thank you very much, Petra, and hi, everybody. So today I'll delve into the transformative impact of the private sector on TB case notification in Pakistan and the way they are delivering the patient-centered quality assured services to the patients and the communities. Next slide, please. And over the last couple of years, we have seen that how the private sector in Pakistan has evolved and how the contribution has significantly improved over the period of time in the overall TB case notification in the country. And just so that you know that this contribution is that you are looking at the slide is basically from the private sector that is being managed by the Mercy Corps, which is the principal recipient for the Global Fund grant in the country. Overall contribution from the private sector is around 41%. Next slide, please. You can also see that how there has been a substantial increase in the number of cases in the last 2.5 years, from around 22,000 cases per quarter to around 50,000 cases, while maintaining a treatment success rate of around 94%. So these are just the numbers. Next slide, please. But I'll just quickly walk you through the integrated model that has played a pivotal role in this success story in the country. And as you can see, currently the country has engaged, there are different models that are being integrated into the one to provide patient-centered services to the patients and also to bring these services closer to the communities. With the support of the Global Fund grant, Mercy Corps Pakistan has engaged over 12,000 private healthcare providers, 378 large private hospitals, 40 mobile vans. All of them are equipped with digital X-ray machines, and some of them also have expert testing facility, and these vans are used to conduct mobile screening camps at in the outreach. Then there are pharmacies. A mobile application and online treatment tracker is being used. These pharmacies are not only engaged to refer the TB presumptive to the private or public facilities, but also to trace back those private providers who are prescribing the medicines to the TB patients, who are treating TB patients, but they are not notifying the patients. They are not part of the system. So with the help of this intervention, we are trying to reach to those providers as well as to provide quality assured services to the patients who are being treated at these facilities. And then there is a specimen transportation model. So among all of these interventions, and a very small community engagement part as well, apart from the specimen transportation, which includes interactive voice response awareness for not only for awareness raising, but also to improve self-referrals from the communities. And for TB preventive treatment, which you all know is a big challenge for all the countries, we have now engaged some counselors at the district level who provide counseling on the importance of initiating TB preventive treatment for the eligible people. Among all these components, I would specifically like to highlight the specimen transportation model, next slide please, which is a game changer in the country. Why it's a game changer? Because this is a model that is actually strategically bringing the services closer to the communities and to the patients. How this model works is that there are community volunteer riders who are engaged. These riders get registered with the support of an online application, Riders for Health. And in a cluster, there are public health facilities, private health facilities, there are clinics, large private hospitals, laboratories. Whenever there is a sample collected at these facilities, the rider will collect the sample, will accept the job, and they get the message from these facilities with the help of a ride management system. And when they accept the job, they will reach to that facility, they will scan the QR code, collect the specimen and transport it either to the laboratory for microscopy or in majority of the cases to expert testing site. So this model has played a significant role in enhancing the RIF-resistant RR case detection in the country. And So my time is already complete, so I'll just be, I'll try to complete it a little fast. The only notable thing that I would like to mention here is that with the help of this model, more than 276,000 samples were transported in almost last 2.5 years, of which 8% of the samples were initially notified as negative on microscopy, which turned out to be MTB detected. And of those, 3.4% samples were diagnosed as RR cases, which otherwise would have been missed. And so that's why we think that this is a very important model, which actually makes the service the first point of contact of the patient and turns that into a service delivery point. And now my next slide, which is the last slide, and just a couple of things, that now we are moving towards the digitalization of the program interventions with the support of the Gates Foundation. And all of these interventions are being linked with the District Health Information System tracker to get the real-time data and to provide real-time and immediate support to the patients. Thank you very much. Over to you, Petra.
Petra, you're on mute.
I'm sorry that I was unmuted. This was a fantastic presentation with so much detail, Amna, and the practical details that you have set in place in a simple graph is absolutely admirable. And the numbers and what you're talking about, how you bring the services closer to where people seek care, to immediately with the riders surface move the samples and not the people, and not referrals of the people, but actually support the people in where they seek care. And as you also clearly point out, that having the diagnostic services, not just the microscopy, but actually the testing, the molecular testing that we want, is of course giving you a much bigger yield in finding the real people with TB in a much wider way. Thank you for showing us these examples, and for anyone who wants to know more about Pakistan, reach out to Amna. I would like to now move on to get some very great results from Vietnam, and I'm really delighted to introduce Dr. Huy Nguyen, who works with Fit TB in Vietnam and has been working with pharmacies over the last many years. And please, if you would like to introduce yourself and share a few of your results from 2023 and some of the highlights of your work in engaging private providers.
Thank you, Petra. Sorry. Thank you, Petra. Good morning, good afternoon, good evening, everyone. So I'm Huy from Fit Vietnam. I'm based in Ho Chi Minh City office. Today I'm very honored to be invited here for the town hall 2023 to say something that's quite modest result to compare with other countries, because you know that is the population in Vietnam is not so many, it's 100 million. And then I think we have a few slides to share that Petra. Yeah. So.
Okay, yeah, I can share them. Just a minute.
Okay. Yeah. Thank you. So, and then I've had 5 minutes to talk about what we have been doing in Vietnam, and we look ahead for the next 3 to 5 years that we already got funding from Global Fund and also from USAID. So we are very, very happy to look forward to the next years to expand and also to more success in the PPM implementation in the country. So I think for the
so sorry, I'm having trouble with the slides. I'll try and get it, but wondering.
I can share it.
Thank you. I think you
share.
Okay. So I just have 3 slides, and then already it's 2 minutes for me. So, so this is like a summary of what we we have been doing in the last 6 years. But you can see that from we are very young NGO in Vietnam. So since 2017, we just piloted it's 2 districts in the model is the BCBS, and stand for proper care in the private sector. And then after 18 months, we got a lot of success for that. We expanded into 19 districts in 2019 to 2021. And then in the last 3 years, from 21 to 23, we expanded to 15 provinces. You know that in Vietnam, like I said, that we have a population of 100 million, but in our 15 provinces, we cover around 40% of the population, so around 40 million people in the gross of 15 provinces. So we adapted the model from India, actually it's from PPIA, and then we adapted and revised to the situation in Vietnam. I think that some of you already see this summary. I think Monica and Petra, of course, you know this this slide, and then this is like a summary of what we go. So from here, from 2 districts only, and now after 6 years, we expand to 150 districts, and then 40% population in the country. And then so next slide, Petra. So just last Wednesday, we organized a close meeting of the last 3 years, sponsored by Global Fund. And then you can see here the guys, the middle of the picture here is the chairman of National Program TB, and all of the delegates from 20 provinces in Vietnam together. And then we had a lot of fun, and then we had a lot of experience, a lot of information to share, and then to look forward for the next 3 and 5 years. So the last slide, Petra. So I'm very excited to share that thanks for TBPPM Global Network, and then we translate this portal, and then to put it out the pharmacists, and then the pharmacists, they're very, very happy that within poster, they can have the knowledge about TB, and also they can transfer those information to patients. And then it got very excited to us that they learned that very quickly, and then also the patients and the clients and around the pharmacies can know about TB very quickly. And then we hope that in the next few years that we will spread out more and more in the pharmacies in the project provinces. So I'm over my time already. So thank you so much for listening, and wishing you all the best for the Christmas and the New Year ahead. Thank you.
Thank you, fantastic progress. It is amazing to see how you went from 2 districts, as you say, small initiative, to actually covering so many and having the full support, the political support, as you showed in the picture. And of course, we are delighted to see that some of the products that we have been working on collaboratively with many members is being used in Vietnam. So great. Thank you for sharing that image. That's wonderful. Thank you, for sharing an inspiring story from Vietnam. And I would like to now turn the floor to the Philippines. The Philippines has been, and we have 2 colleagues from the Philippines with us, both Lalen Mortera and Diana Malari. And they'll be sharing a few thoughts from what is happening in the Philippines these days. We know that in the Philippines that you've gone through a massive reform recently, more looking towards integrating TB as one of the many issues under universal healthcare coverage. And we'd really like to hear from you an update on how was 2023 for you in your work, and how has the private sector and tuberculosis been impacted by the many reform changes. And so if I can hand the floor over to, is it Lalen who's starting? Is it Diana? I will ask you both.
Yeah. Sorry,
Diana.
I was speaking. Yeah, I will be
Diana,
starting
go
the
ahead.
presentation. Yeah. Okay. I'm sharing the file. Okay. All right. Good evening, good morning, good afternoon, good evening, everyone. I am Diana Malyari from the Philippine Department of Health's TB program. I am joined here by our TB focal, Ms. Marlene Galvan, as well as Dr. Leline Mortera from USAID's TB Innovations Project. Our presentation covers two key parts. The first one is the private sector engagement initiatives funded by our donors, the Global Fund and the USAID, and the private sector engagement opportunities in UHC. So one challenge we are trying to address is the high proportion of CD/TB cases in the private sector. To improve access to rapid TB diagnostics, Striders now covers private facilities using motorcycle riders to transport specimens. Aside from that, the Philippine Private Sector Diagnostics Consortium, or the consortium, was organized, which ensures access to high-quality diagnostics at concessional pricing. In 2019, the DOH approved the use of GeneXpert for viral load testing, aligning with integration plans. And then to support mandatory TB notification, the Access TB project launched two activities, which is the RX Pass, which seeks to increase TB screening by providing free chest X-ray vouchers and enhanced TB diagnosis quality to private patients through accessible sputum collection and collection facilities linked to expert testing laboratories. While the physicians incentive aims to recognize physicians utilizing GeneXpert as the primary diagnostic and the diagnostic tool and those reporting treatment outcome. And then the ITIS Lite, which is the recording and reporting tool, accessible via web and mobile app, helps private physicians to notify TB cases to the Department of Health. These initiatives represent a snapshot of our efforts to engage the private sector. Now I'll be passing the virtual mic to Dr. Leline Mortera for the second part.
Yeah, thank you, Diane. So way back in 2003, private providers either refer or be accredited to treat, monitor, and notify patients with TB, and eventually receive the outpatient TB benefit package from the national insurance called PhilHealth. This package excluded screening and testing and has not changed since. When the Universal Healthcare Act became law in 2019 to strengthen primary care services, the Consulta package was introduced in 2020, an opportunity for individual private providers to be accredited and contracted or join a network to serve a catchment population, and eventually receive capitation higher than their government counterparts and paid 40% in advance and additionally paid based on services provided after the first patient encounter, which include any of 13 diagnostic tests and 21 medicines in the package. The chest X-ray not covered in the previous package is now included, which supports screening to identify presumptive TB. Now, there were only 39 private providers, or less than 10% among the accredited Consulta providers as of June 2022. Now, to support DOH and PhilHealth, FHI 360, through the USAID-funded TB Innovations Project, documented private sector experience in this journey. So as a case study, we assisted a for-profit family-owned diagnostic clinic in a rural community who did about 14,000 X-rays, referred 130 TB cases, and received PhilHealth claims of about $6,000 as baseline. With our support, we introduced artificial intelligence in their system, linked the private facility to the local government unit as contracted mobile X-ray provider, in the latter's active case finding through an MOU, and link the facility to a TB provider. To date, their X-ray census doubled, claims increased 4 times, and referred 4 times more TB cases for treatment. The same provider is now considering to be accredited as a TB service provider, and its story now planned to be used to inspire other private providers to be accredited for Consulta. Now, to integrate primary care services with existing individual health packages, FHI 360 again supported DOH in developing Consulta Plus SDG, which now includes TB, HIV, animal bite, and malaria, alongside PhilHealth's medicine benefits called Gamot and the annual case rate benefits as a prelude to the comprehensive outpatient benefit package. Now, this is now a network of providers accredited by PhilHealth and contracted by the LGU under a province-wide health system. Now, the Consulta Plus SDG aims to combine a higher amount of capitation, fixed co-pay for service for the private, and case-based rates paid prospectively to the network. It also includes experts in the package. The ongoing pilot in selected sites is largely public for now. However, in due time, private sector can participate as part of the network. System support like EMR, incorporating digitalized mandatory health-based assessment, which systematically lead to testing, treatment, and push data to notification-based claims are in the pipeline. So definitely integrating TB services in primary care will systematically link the population to access healthcare system for screening and testing, finding more cases of TB. And this time, using country's health insurance. So back to you, Petra.
Thank you, Lalen. Thank you, Diane. I'm almost wonderful to see the level of detail that you're able to cover in 2 slides, and the fact that at the primary healthcare level you're able to cover the insurance services the way you've set it up is very impressive, and congratulations to both of you for all the work that you've been doing. It's some really great inspirational progress to hear from both of you. Thank you so much. And thank you for joining us so late in the Philippines. It's always awkward to get everyone on one time zone. I know, Hui, for both of you, it's way past bedtime. So I really appreciate that you're still with us and even presenting in a very coherent way. I would like
it's always
to now...
a pleasure, Petra.
Thank you so much. Thank you so much for being, and we totally understand if you need to drop off, but thank you for sharing these amazing results from the Philippines. So I would like to now call on a few people, and both Diane and we have been joining the TBPPM course in the very first take in 2022, and we reached out to the alumni of the course of this year, and I'd like to call on Dr. Swati from India to share one slide and maybe a few words about can you tell us from 2023, what are some of the highlights from your perspective in PPM that you have seen, and how has the learning in PPM impacted your work in 2023? Go ahead, Swati.
Thank you, Petra. Thank you so much for this particular opportunity to speak here. So I'm really very privileged to share a few words for this virtual town hall of TBPPM Learning Network as an alumnus from the last batch of TBPPM course. It has indeed been a pleasure being associated with the network, and it has deeply impacted my TB work positively. As many of you are already aware, the public-private partnership initiatives in TB control or other TB elimination efforts are at an all-time high in India, thanks to the significant efforts of the TBPPM Learning Network India chapter under Dr. Shri and a few similar organizations. And hearty congratulations for the launch of the official secretariat of India chapter with IPH Bengaluru, and also the much-needed NGO mapping activity which is currently underway. So my key learning from the TBPPM course, which was conducted in last May, was the realization of the importance of sustainable partnerships among TB programs and the private healthcare delivery sector, and that not the mere collaborations are not enough. I also got a chance to learn about the contextual similarities and differences that influence the epidemiology of TB in other high-burden countries through the interactions with my co-participants in the course. The participants of the course was a good mix of public health professionals, policymakers, program implementers, scientists, and community health advocates, which opened up a chance to get a varied perspective on the challenges and enablers of engaging with the highly fragmented private sector and the way forward. So such a learning platform helps us to cross-learn and is pivotal in propelling our activities towards attaining the goal of TB elimination. Now, bonuses are, of course, collaborative technical work for the common goal and indeed lasting friendships. The India chapter would provide us with more opportunities for a global South-to-South exchange of ideas and creation of multidisciplinary technical networks for the cause. Now, being a public health physician cum researcher working in a research NGO, I work for a research NGO called KEM Hospital Research Center, which is in Pune district of Maharashtra. At this point, I would like to share my slides, which has a few photos. So if you can see these, Petra, could you please tell me?
Yes, they are very clear. If you can
Yes,
quickly go through them, Swati, thank you.
Yeah, thank you. Being a public health physician cum researcher who work here and also as a technical person working with India's TB elimination program at national, state and district levels and various capacities, this course and the various follow-on activities in the form of webinars, monthly newsletters, etc. It really helped me substantially in the daily work by facilitating peer learning opportunities. So as far as our activities are concerned, our organization, which is KEM Hospital Research Center in Pune, we are officially partnering with the district TB program to implement the community engagement initiative of India's TB program, which is currently launched. It is called TB Mukt Panchayat. It essentially envisages TB-free villages. And villages have local self-governments, which are called panchayats here in India. And under this initiative, the panchayats or these village local self-governments are co-working with the health department to achieve TB elimination. So we as a local technical and research institute, render our services to sensitize the local self-government bodies on TB and the national about TB and national TB elimination programs efforts. And also we conduct massive awareness campaigns for the general public. So all these are intended to create a demand for TB care cascade services from the community themselves by making it their felt need. Also, one point to add, our ongoing health and demographic surveillance system census data shows that 5% of the adult population goes to pharmacies for primary healthcare seeking for common illnesses. So we believe that as a next step in this TB-free villages initiative, it would be a good idea to engage these local rural pharmacies for TB screening and as sample collection depots, as these have potential, immense potential to harness the chunk of symptomatic individuals who do not get screened or tested for TB. But of course, discussions are underway and hopefully it materializes soon. So again, once again, I thank Dr. Pai, Dr. Shri, Petra, and the entire amazing team of TBPPM Learning Network for this wonderful learning initiative for us TB advocates and for providing us with cross-learning opportunities and giving a direction for our work. Thank you so much.
Thank you, Swati, and it's wonderful to see the pictures of the work that you do. Well done, and thank you. I'm glad to. It's great to hear that the course has actually inspired so much of your work. And now I'm taking you across the ocean to Nigeria, and Stella Makpu, who works within the Nigeria tuberculosis program in the national program, is with us too. And Stella, can you take 2 minutes? I'm trying to press time because I want everyone to give everyone the floor. Stella, the floor floor is yours. Can you tell us in maybe a few minutes, are you in the review meeting, the annual review meeting still?
Yes, but
Go
we
ahead.
are done. Yes, thank you very much, Petra. Sorry for joining late. In fact, I want to thank TBPPM Network for putting up this to continuously enhance our output. So in Nigeria here, we are really trying our best and doing what we're supposed to do. For at the beginning of this year, no, not really, but mid this year, around July, we started what we call the TBPPM. The TBPPM program, we're piloting it in 12 states of the country. And we have about 6 geopolitical zones in Nigeria. So we selected 2 states per geopolitical zone. So in each of the states, that's making it 12 states. So in each of the states, we have 3 high burden facilities to pilot this. So what we did, the essence of the TB is to improve data quality. That is the quality of data that the facilities are reporting, as well as the services, services being rendered at the facility level. So what we did was to collect the baseline data from these facilities, and we also visit, not really visit, but virtually we communicate with them to update whether there are improvements in those data we are collecting. So what we did was to ensure that we always are in touch with those in the facility. So as we monitor them, we make sure that we give them feedback, and it is this feedback that will help them improve. And we also collect data from them to compare. So the TBPPM program has run for about 5 months. It's 6 months pilot. So by early next month, that is beginning of 2024, we'll be able to give out the result of this project. Then also, we also did what we call, or we are also thinking around constituting a more viable TBPPM steering committee. Because right now, what we have as a PPM steering committee is actually not a representative of all the private sector that we want to have. So what we are going to do, because we have learned lessons from the malaria program, because they have a more a more solid TB private sector. So what we want to do is to write to this private, engage more of this private sector. We want to include those in extractive industries, manufacturing industries, those in even specialized private sector like banks, like those in telecom communication. So what we want to do is to ensure to write them and try and communicate them, to give them feedback, yes, to ensure that they join us, so that we'll be just in the spirit of having a government giving a government giving a comprehensive so sorry, I'm losing touch. But it's yes, that is to have a government to have a government buying in of these private sectors, so that we'll have this funding, funding for most of our implementations in the private sector. So that is what we are doing for now. Thank you very much for this opportunity.
Thank you, Stella. I know you're in the annual review meeting, and so it's great to hear that you're able to share some of the initiatives that you've been doing in this year and wanting to strengthen the steering committee to really make it representative with a much broader activity that's happening with Nigeria. Thank you so much for joining us. And I would like to, because we are running a little bit tight on time, Stella, keep the good work up in Nigeria, and we look forward to hearing more of the outcomes and all of your work in the future. So please stay in touch, and thank you. So I have one more person that I would like to give the floor who wants to share some of the work from Tanzania, and that's Dr. Rabia. In the meantime, I would like to also know that we have planned a whiteboard session where we wanted to put some questions up. And Rabia, do you think you can keep it really short and tight and maybe try and do it in 2 minutes? I know you have some slides. Do you want us to put the slides up for you?
Yes, please. Yes, Petra.
Okay.
Just
Joel, are you able to share the slides? Or
yeah, share from your end.
Yeah. Let me have a look. I should have prepared this better. Sorry, everyone. Here, I have them. Okay, so Rabia, you have 2 minutes, and in the meantime, we're also going to put some questions in the chat that we would like you to start thinking about for our whiteboard session. So if you can have a look at the chat while you're also listening to Rabia's presentation. Rabia, go ahead, please.
Okay. Yeah, good morning, greetings, and good evening, everyone. I'm Rabia Kaji, and I work with Shidefa Plus. I'm the head of MNE and TB portfolio at the organization. So it's very grateful to be part of this platform and share the work in TBPPM. So we have this program. It's under the tuberculosis loan, USAID, and it targets the mining communities, fisher folks, people who are at breweries, local breweries, traditional healers, local pubs, and etc. But this focus is on the adults, the accredited drug dispensers, or the local pharmacies. So we engaged the pharmacists or the local providers from the pharmacies at mining community to provide the TB services, where we were able to train them, orient them, and provide them with tools. So during that process, we had to link them with the community health workers working within the mining communities. And in doing so, we saw that because before then we could do the public announcement services, but we could see only low yielding. But after engaging this ADO or the pharmacy, which are within the mining community, we see things were changing because by then the program had little funding. So it was important to engage them in a way that they did the screening, the leaf fellow services by either referring the sputum sample or the clients after linking with the community health workers. So with that, as we can see, those are the ADO dawa muhimu za binadamu. We call them in English, in Swahili, they are within the mining communities. So through that linkage, we saw the changes, and this one we mapped it into in 3 mining communities, 3 mines. There were 15 ADOs, 5 per 5 within those mining communities. So we saw changes coming after that initiative, and it was only this year, September and October, we saw things were coming in terms of people who were educated with health education, including TB, people who were being screened for TB. Petra, we can move on to the next slide. People who were being screened for TB, but also those ones who were notified with tuberculosis. So from the graph there, within those 3 mining sites, a total of 9,958 people were provided with education through the ADO within the 2 months, but 825 were screened for TB, but again 495 were presumed to have TB, but then collected sputum sample, which was linked to the health facility with a gene expert for further diagnosis. And 60% among the samples which was tested were confirmed to have TB, bacteriologically confirmed, which were then enrolled to treatment. And besides that, because the HIV services was also offered during the service, 3 HIV TB cases were also identified, which are now into care. So what is our call now? We can see that engaging adult providers and synergizing the linkage between the community health workers and the adults themselves or the pharmacists is very important, especially when it comes to TB case notification. And applying now to the knowledge which we learned during the TBPPM, we can see after the midterm review which was conducted in March in Tanzania. So there is need to have this TBPPM dashboard because adults are missing, they miss data, tools to record, but also supervision of things like orientation or capacity building is also a challenge to them. But we are glad that in this global funding mechanism, they have been included, and we expect that a lot will be improved, especially also by reaching these adult providers who are within the key population groups like the mining, but also the issue of digital technology. So now there is this one we call community TB app. So we do hope this one will also be included for further improvement. So we have seen that adult providers plays a potential role in TB case detection as they are widely used by these KVPs like mining community because whenever they feel they have coffee, they tend to do self-prescription. So they go and get the, we call it, like something like syrup, to dissolve the coffee. So they are the contact of those KP groups, and that is very important to engage them. Yeah. So to end TB, so targeted intervention like the way we have seen, there is need not only to increase private sector contribution to TB care, but also we need to strengthen the community involvement and enhance collaboration across sectors by demonstrating the commitment of achieving this ambitious target of the UNHLM and the national targets for improving TB. Like us, Tanzania now, because we are at 15%, we are planning to at least extend the private provider achievement to 25% by 2060. Yeah, thank you so much, Petra.
Thank you, Rabia. I'm so sorry, I need to press you for time. From a very small but really important vulnerable community, we know that the minors are impacted by TB. It's fantastic to hear how you are actively engaging the chemists in those community and bringing everyone together to support the people with TB. Thank you for sharing your initiative, and I'm really sorry that I needed to press you. Rabia, please keep up the great work that you're doing, and I would now like to hand over to Joel to lead us through a few questions on the whiteboard. And Joel, I think we can take 5 to 10 minutes. I'll go fast through our presentation. So go ahead, Joel.
Thanks, Petra. It's a wonderful problem to have that we are going over time, hearing about the experience that PPM has been, the progress that PPM has been having in 2023. I've also dropped that question in the chat. So Golibe, thank you for your response. That question is still open in the chat for people who want to respond. What is one memory from your country or your organization that you think of in 2023 that's related to PPM and TB? That's open in the chat. But for the whiteboard, the question that we have on the whiteboard is going to be, how has the TBPPM Learning Network impacted your work or learning in 2023? And I'm just going to post the question here. So for you all can respond by just clicking on either the sticky note or the text. Just click on the text and you can add in your responses here. How has the learning network, the TBPPM Learning Network, helped your work or learning in 2023? Um, you can type in your responses away from the question. To type in your response, just click on this text and type in your response. When you click on text, it'll allow you to type anywhere on the screen. So if you have typed on the screen and your response is not appearing, just let me know and we can zoom out and search if your response is caught up somewhere else. We have a few responses coming in. Okay, so we have two responses on how the learning network has helped the work. We have somebody typing that it helped in engaging the private sector in the field. And we also have a response on the adaptations have been helpful, I guess. If you find it difficult to type in your response on the screen, please type it in the chat too. Again, so to type the text, if you just need to click on the T icon on the left of the screen and type in your response.
Joel, sorry, but I couldn't find the T icon on the screen. Could you please share how to
Okay.
find?
When you move your cursor to the left of the screen, you can find T. Well, if you can't find, let's just do it on the chat then. How has the learning network impact? I'm gonna close the whiteboard. Let's just do this on the chat. How has the TBPPM Learning Network helped you in 2023? I'm gonna pause for a minute so that we can have some responses on this.
Joel, how many questions? Maybe you want to put the next question in there too, so people can respond.
Sure. The next question is, what should be the priorities for 2024?
And if people want to talk, we can also raise your hand. We would also love to hear instead of chat writing, right, Joel?
Yeah, sure, Petra. if anybody wants to share, yeah, just feel free to raise your hand and I can call on you to respond to the question. Great. So we have some responses on how it has helped in networking and learning and the pharmacy infographic. Great. Thank you so much for all these responses. We'll quickly move to the next question. What do you think should be the focus in 2024 for PPM and for Learning Network? In PPM in general and for the Learning Network, what do you think should be the main focus in 2024? So we have responses still coming in for how the Learning Network has impacted the work. And for the upcoming year, research and publications and more documentation of best practices, capacity building for the private sector should be the focus for 2024. Great. Thank you all for the responses, and I will hand it over back to you, Petra.
Thank you so much. I know we should have planned a little bit longer. I'm going to fly through a presentation that we have prepared to update you. Even though we have 10 minutes planned for it, I'm going to try and keep us on the agenda because I know you're all joining us from different time zones. So to get you up to speed, we do this annual town hall to bring everyone together and have our community get a chance to speak. So you've heard from Monica and from Madhu that we are basically in a situation that this year, the pandemic recovery, we have seen people in general in the world are moving towards preparedness. There's a lot of focus on universal health coverage, and the UNHLM also highlighted that with commitments. And the TB data the one good highlight that we saw that there are more people being diagnosed. So there is a lot of hope in the TB community on scientific advances, an active community, and multiple sectors are involved. And of course, that's where PPM fits in. You all are familiar with the way our framework is, where the experts in PPM is you, the implementers at the country levels. And that's how we try and provide learning and exchanges together in the circle of our frame. I won't spend a lot of time on each of these boxes, but if I look at the achievements of 2023, I think we can categorize them in 3 areas. What is our reach? What type of topics, what have we learned, and how have we engaged our community? And I'll fly through a few of these. So in terms of our reach, we've seen that our community has grown now well over 2,500 members. There are 112 countries where you are being represented. And nearly 50% is in the big 7 countries with a large private sector. If we look at people representation between South and North, we can see that there's about 60% in the South. We have 2 active country chapters with over hundreds of members in India, over 650, and in Nigeria, nearly 200. And there's interest in chapters with lots of other members where there are more people together. So if we look at the area of learning, we've done a lot of work this year in the area of within the broader context of universal health coverage, strengthening health systems. We've listened to country reviews and the data coming out on the COVID impact from the COVID studies. We've looked at empowering providers. We've started documenting some of the lessons, such as a case study in Nigeria on the lab, hub and spoke work. And so some of these documents, knowledge products are provided here. And as you saw in the presentation, we have worked on an infographic for pharmacy that also is now being translated in various countries. Thanks for sharing that from Vietnam. So our work is webinars where we engage, forums where you can talk to each other. Our big course that we had as part of the McGill Summer Institute for the first time this year, with over 100 people registered, about 75 people participated. Different knowledge products, feature stories, which are the stories on your work. And we synthesize that information in news posts and newsletters to bring it to the much wider community of people that are interested in this topic. So engaging is through our platform in a large way, because most of our work is online. We realize that many people are becoming more interested in meeting in person, and it was fantastic to meet so many of you during the union conference, and really gathering in person is also what is shifting the way that we connect. So it was good to have some sessions on PPM in the union conference and in the PPM working group meeting. And hopefully there will be more in 2024 when we look at that way. Where in India and Nigeria, through the IPH secretariat and the steering committee that Stella was talking about, those are opportunities at national level to really engage around PPM. And so behind the scenes, we are involved in trying to connect many of you with each other to provide information. And of course, there's social media. All of this comes together at the country level. That's where you have the engagement and the learning and the reach at a wide level. And I'm really happy to see what we had in India. And you've heard several stories about the NGO database, the compendium with the many stories, both in Nigeria and India, the work that is going on mentor-mentee, and various forms of documenting the work of implementers, whether that is through feature stories or through, in some cases, manuscripts, materials, and in case also the virtual site visit. So looking towards 2025, which our current action plan is, one of the key points for 2024 is that we will be looking at evaluating our country chapters. And that's going to be an important piece that will inform what the work is that we do, and how the TBPPM Learning Network can more provide a connection, not just on knowledge, but connecting knowledge to action. And so that is one of the things that I want to highlight. And there are several targets that we have outlined, and we will take many of the points that you've put in the chat today. I've heard many of these. I'm glad to see that many of these are already part of our overall targets of sustaining the community, supporting learning, and maintaining the online digital platform, and empowering PPN champions, and create a positive ecosystem. So with that, I would like to thank everyone for your engagement, and keep up the energy and the ambition to connect TB systems in all the levels. And with urgency, we need to really push out our newer regimens and of the scientific advances that also all healthcare providers, including the private healthcare providers, have access to those. That means also the new diagnostics. And I think the stories that you shared today with the various examples from countries with the different riders is really seeing that this is happening. And I am hoping that we can showcase that model, that more and more countries, private providers are engaged in such networks, so that they have access to the shorter regimen, but also the diagnostics for their screening and testing. So the community is strong. Let's keep it up, and let's work together in the future. And I'm gonna just hand over back to Joel, who is going to celebrate some of our community members.
Thank you, Petra. Before we move on to the celebrations part of it, I would like to really thank everyone for your responses, and also to take a really nice picture of all of us together on the virtual forum. We really got really good pictures in the union booth. So thank you all who were able to join us. And now let's just take a quick picture. So if you're able to, and if you can have your cameras on, that would be great. I'm gonna share the instructions again on how you can change your virtual background. So I'm just gonna pause for like a few more minutes to see if you can have your cameras on, and we can take a quick picture. Okay, so in 3, 2, 1. And we have 2 pages, so bear with me. And 3, 2, and 1. All right. Thank you, everyone, for patiently waiting with us. And honestly, like we have a wonderful community, and that's our strongest strength. And I'm just gonna quickly share some of our highlights from some of our communities that happened in 2023. Okay, so in 2023, we actually grew up to 2,822 members. What you see on the website is just 2,582. That's we also have what we have the website as well as another component as well that's beyond the website, that where the learning network is active, and we have 240 people who attended various TBPPM events but have not signed up on the website yet. We've been trying to get them to sign up as well, but yeah, we have the 2,822 members. In 2023, out of these 2,822, 1111 engaged in the learning network, either through the website or in some form of activities. And 498 people collaborated with us in different aspects of our work. And 467 people participated in one of the TBPPM core activities. The core activities that we call the features, the webinars, and the Friday forum, and the course. These are our TBPPM Learning Network's core activities, and 467 people participated in that. Among these 467, we just wanted to know who are the top 3 active members. And we announced this contest last week, and just also giving an opportunity for others to win as well. I'm happy to introduce to you the top 3 active members of 2023. We have Rabia from Tanzania, Golibe from Nigeria, and Gulam Kadir from Afghanistan. They were very active on the website as well as participating in the TBPPM core activities as well. So if you could just send in some hearts or send in some celebrations for them. Great. So thank you all for sharing your feedback on how the Learning Network has impacted your work in 2023. This year, we have put together a comprehensive survey. It's, I think, 3 to 5 questions of just to hear your feedback. So I will share the link to the survey as well. It's also on our Learning Network. It's already posted on our Learning Network. So please do go in and share your feedback on what we did well in 2023 and what you would like to see more in 2024. In this survey, this year, we are also launching an option for you to submit a video survey. So if you want to, if you are candid about it, and if you want to submit a video, quick 2-minute video about your work, if you can share that, then we will be able to, you will have a chance to enter a lucky draw to win a discounted fee to attend the online TBPPM course. So just look out for that link, and you can take a look at the website as well. We are also happy to launch another contest. Like this is the image that Hui shared. We had last year, one of our significant moments was the pharmacy infographic being used across the world that was put together by our community members, experts in pharmacy, who got together and worked on this infographic, and that has been widely accepted and widely used. So in an attempt to find what kind of information is there in private providers, in the private provider office or private provider clinics, we are happy to launch this poster hunt. So all you have to do is snap a picture of a poster or a flyer that you see in a in a private provider's office. It could be a clinic or a lab or pharmacy, anywhere you see it should be a private provider. needn't be a government institution, but if you find a poster or any form of TB information material there, just click a picture and send it to us on a form. We've set up the form. You can find the form on the website as well. So send us the picture, and you can send multiple pictures, but just be sure that it should be different poster each time. And it can be from the same clinic too, but it should be a different poster at least. And this is open only for members of the Learning Network. So you can find more details on our website, and just email us at tbppm.info if you have any other questions. Back to you, Petra.
Thank you, Joel. Thank you. Congratulations to all the fantastic active members. I'm so proud to see all of you. Well done, and thank you so much. In our annual report, we will be doing a little bit more analysis on our membership and how we compare with other networks. But I already know that as an active proportion of all of you is better than many of the online providers. So you can be proud of yourself. Thank you so much for being part of this fantastic network. And I would like to, last but not least, there's so much more that we would like to share and would like to talk about, but I would first like to give Guy Stallworthy the floor, who has been a tremendous support from day one and even before the network was even launched. He has been already for 30 years engaged in PPM activities and is the main driver of a lot of the technical work that is happening in countries. And Guy, thank you so much for your endless support in the Learning Network. And we'd love to hear from you, from your point of view, what are some of the, if you look ahead and where we are these days in PPM, what do you see as some of the priorities towards 2024 for, in general for PPM, but also specifically for the Learning Network?
Thanks, Petra. Can you hear me okay? Good. I won't keep you very long. It's been a wonderful session. I've really enjoyed this, and congratulations, first of all, to you and the Learning Network team and all the members, these active members around the world, for a very successful year, very active year. It's been wonderful to observe the way this network has evolved and meeting its core purpose of South-South learning and an opportunity for the real implementers, people who maybe don't always get to attend international conferences and other meetings, to share their experiences and learn from each other. It's really great to see that happening on this scale. I really appreciate the rapid fire little presentations and sharing of experiences that you all did earlier on in this call. It was great, and I'd love to see more of that. I think in some ways I'm reflecting on the challenges for the Learning Network and for PPM in general. I'm struck by how so much has changed over the years and so many things also remain the same. New technologies, new opportunities, a much broader learning network, of course, and so many wonderful initiatives happening in different countries. The challenges remain what they have been, which really in my view, have to do with scale. We have so much more to do in terms of taking these wonderful ideas to scale, continuing to innovate, continuing to enrich our understanding of how to do this work. There are new challenges as well for PPM that weren't there 20 years ago. Challenges that we have to rise to about how to do preventive therapy at household level in the context of PPM programs. And we really have been neglecting social support, nutritional and financial support for too long. I think these are things that remain. We have some instances in which we talk about the missing patients, the gap between notifications and incidents. Sometimes I think we also should pay more attention to another gap, and there's a gap in some countries between notifications and service delivery. It's not enough just to note that there is a TB patient out there. We have to get much better in some countries about really delivering meaningful TB services and social support to those patients. And there's a few places where that doesn't happen. The data challenges that Monica touched on earlier, that remains something where we've still got to do much better, I think. But there's progress. There's many opportunities. Some countries, as you heard from the Philippines, the social health insurance is an opportunity that we haven't yet tapped into. Unfortunately, that doesn't apply to many countries, but in the future, it's going to be increasingly relevant. But really, what I'm happy about is to see, as you've touched on and others have mentioned, the opportunity for a new leadership to emerge in this field. There's so many exciting experiences that are happening around the world. And it's great to see people stepping up, getting some experiences outside the country where they've started work, and really taking this field of PPM into the future. I'm not going to say any more because it's been a wonderful meeting and I know it's late for many people, but I just want to thank everybody who's played a part in the Learning Network, all the members who've been so active, and then of course you and your team for facilitating it over the last year. And I look forward to even better things in 2024. Thank you all.
Thank you, Guy. That's a fantastic closing, and really appreciate all your thoughts and continuous challenges for how we can improve. All of these are topics that I've noted down, and I look forward hearing like bringing the community together around many of these issues in 2024. I agree with you that bringing our PPM work to scale is one of the big challenges, and it's fantastic that the Global Fund is putting money on the table, but it really needs to be at the country level itself, where the sustainability of long-term programming needs to be thought of how we can include these private providers. And so, yes, the health insurance systems, as in the Philippines, is one example, but we know that there are many more. So we'll bring some of these topics back in 2024. I want to put one little flag out for any organization that is looking in funding for their work. We're doing a forum next week with TB Reach. And as you saw from Hui's presentation and some others, some of the small initiative work starts with funding from TB Reach and then can be brought to scale later on. So if anyone is interested in that, Jacob Craswell from Stop TB and many others that have been involved in TB Reach products will be with us next Friday. I am looking at Joel. Is there anything else that we need to announce before we close this meeting and thank everyone for all your fantastic contributions? Is there anything else that we need to bring forward? Is there anyone in this group who wants to say a last word? If not, then I would like to wish everyone a great December. Get the last things done that need to be done in 2023, and I hope you all will have a well-deserved break, with holiday wishes to everyone for their festivities. And I am really happy to see you all together on this snowy day in Ottawa. Thank you so much for all the work you do and your engagement in our community. This is really how we can push the energy forwards towards NTB. So people, thank you, and looking forward to seeing you all again.